CEO of the Colorado Health Network, Darrell Vigil.
Thank you all for being here, and thank you, Mayor Hancock. I'm just so overwhelmed by that spontaneous live auction and this wonderful opportunity to have someone have the mayor's seats at Red Rocks. I mean, that's just so exciting. So thank you all for being here. Thank you, Bill Meade, for sharing your words. I really appreciate that. Your strong passion for this organization is so evident, and for this cause. Thank you, Mayor Hancock, for your words and your story. I know I've heard your story many times. You've been so gracious to speak for us at AIDS Walk every year that you are available, and we just really appreciate that as an organization. And thank you all of you for being here. You all have your own stories and your own connections to this organization, which are very meaningful and impactful to the organization now and in the past and in the future. So thank you so much. I'm going to talk just a little bit about the future of the organization and also a little bit about what we're doing now. Colorado Health Network is the largest organization in the state, the only statewide organization providing HIV programs and services for those who are impacted by HIV, either living within HIV or impacted by it. And so we have a wonderful group of staff statewide. We have offices in Colorado Springs and Pueblo, Grand Junction, Fort Collins, Denver, and a small office in Greeley as well. And so we have about just under 100 staff in this state who are working to impact the lives of those living with HIV and to help prevent the spread of HIV/AIDS, which I would just really like to applaud all of them right now because of the work they're doing. Thank you all so much. This organization has been around for 31 years, and it started as you saw in the video, as a grassroots organization, people coming together to just figure out what they could do. They knew they had to do something, but didn't know what, because HIV was so new. People were passing away very quickly, and people, some of this I'm repeating from the video, but I think it's worth repeating. We were working with clients and to really help them prepare for the ends of their lives. And so today we can celebrate that we've had so many advances in treatment and care that people can really live into their golden years. This is a chronic disease now, which is so wonderful. Yes, this is something the good news about that, of course, people are living healthier lives. Today we are serving a lot of folks who are lacking resources. So that's one of the big changes that this organization has moved into. A lot of the folks we were initially serving, the majority of them are now living healthy lives. They're living with their own resources, have jobs and have health insurance. But so many of the folks that we're serving today are lacking resources. Before the expansion of Medicaid in Colorado, just a year and a half ago or so, only 16% of our clients, and we serve over 5,000 clients in the state of Colorado, only about 16% of them were eligible for Medicaid. And with Medicaid expansion, 85% of these clients now have access to health care, which is something else to say. Our staff work with these clients to help bring stability to their lives. A lot of the clients that we see are coming in and lacking proper nutrition, don't have regular food in their home. A lot of them don't have a home or stable housing. And so our case management staff work with these clients to assess where they're at and how we can help them, whether it be emergency financial assistance so they're not evicted, whether it's linkage to care so they can get control of their HIV, or re-engagement in care, because a lot of these folks fall out of care because they're focused on where am I going to sleep tonight, or where am I going to get my next meal. And so taking care of their HIV really falls down on in their list of priorities. And so the staff work to bring those stable things to the clients' lives so that they can focus on their treatment and care. And many of you heard this, and many of you know this, that with regular treatment and care, our clients and patients can get their viral loads down to undetectable levels, which means they're healthier, our communities are healthier, because HIV is highly unlikely to be transmitted when there's an undetectable viral load. So I just think that's something to celebrate. Absent a cure today, if we could get everyone into treatment and care and get their viral loads to undetectable levels, we could eradicate this in a generation. And I know that's a huge dream, but it is something that we can do. We've had great success in the state of Colorado. We have seen HIV transmission rates come down, which is wonderful. We're celebrating that. The unfortunate thing is the largest group of individuals who are contracting HIV today are as low as 12-year-olds, but largely 18 to 34-year-olds, and so they're not getting the message. And that's one of the challenges that we're facing as an organization, and we're trying to do more and working with organizations like One Colorado and trying to get into the schools to share these messages. And so I really ask that all of you who have young people in your lives, if you can share that message as well, because it's so important. So many people don't know the stories. Bill Mead shares a story about his former partner who passed away in the 90s of HIV, and Bill had an employer who was gracious enough to let him set up office at home so he could provide daily care to his partner. And I mean, the kids don't know the stories of people being thin and weak, and Bill has shared that he had to give injections into his partner's eyes as part of the treatment. So there are just, I know a lot of you have these stories. We've all had loved ones who passed away of AIDS over the years, and that is part of our past, something that we never want to forget. But I think we need to figure out how to share that story with the younger generation, because some of the things that our staff have heard is that they're really not, that's not something that's connecting for them for some reason, and we need to figure out how to make that connection. They think of it as the past and no longer something to be concerned about. But I talk about people who have HIV today, and it's, you know, although there are so many advances in treatment and care, there are times when it's very, very difficult, and people still have very sick days occasionally. So this is not something to be taken lightly, even though there have been so many advances in treatment and care. So I just really ask that you all work with us to share this message. I have totally gone off script. I haven't read it. So I do want to talk about this campaign, because that's why we're here tonight. You know, we've been looking at this since 2013. We have a wonderful board of directors who's insightful in, you know, wanting to look to the future with the expansion of Medicaid, with the implementation of the Affordable Care Act. We see that we need to be able to do more for clients and patients. And so that's what we're hoping to do. We're hoping to bring our Denver oral health care services, the Howard Dental services, and the DCAP client services and food bank, as well as our statewide administrative services, where we serve the Colorado Springs, Grand Junction, Fort Collins regions administratively. Bring them all together in the metro area under one roof. We've run numbers on all of this. We've been doing this the right way, hiring planners to work with us on what this new location should consist of, what square footage it should have, and what that space should be devoted to. And we've run numbers on this, and we're looking at saving about 25% in operating costs by consolidating these offices together for the Denver Metro and statewide services. So that's really exciting, because those are dollars that come from foundations, come from the government, the state of Colorado Health Department, but most importantly from people like you. And so we can do so much more with those dollars when we're running a more efficient organization in one location. So you've heard a lot of stories this evening, and you've seen information, and we have lots of information in your program. There's a postcard that you can fill out. And I just really ask that you be with us and join in this Compassionate Connections campaign. Fill out the postcards and see one of our staff ambassadors when it is time to leave, and it's not time yet. And we'll be in touch with you to talk about the various numbers of ways you can help join in this campaign. You know, we haven't been able to do this on our own since day one, and we still need your support today. This is something that these services need to continue well into the future. The clients that we're serving, as I mentioned, are living longer, healthier lives, and they're needing our services for a longer period of time. So thank you so much for being here, and I really thank you for everything you have done, and I really thank you for everything I know you're going to do with us in the future. Thanks.